Welcome to this talk. Now, I want to give a bit of an update from Wefwafwa, who's a medical officer in Uganda today, about our ongoing project. Wefwafwa, thank you for coming on the program.
Yeah, you're very welcome, and it is a pleasure to be speaking to our amazing people on this YouTube community.
It really is, isn't it? So this work in Africa has come about by basically people watching my YouTube videos and your YouTube videos. And it's been going on for some years now. And we think this is really important for two reasons. Firstly, we're helping a lot of people locally. There's no question about that. People are being employed, people are being cured, diseases are being prevented, nutrition is being improved in quite a few different ways. And I believe we're also generating ecological, environmental improvements as well. And that's one reason this is important. The other reason is I feel this is kind of a model that other areas, particularly in Africa, could potentially follow. Because we've started off with pretty basic resources, really, you and me, and the YouTube channels, and the viewers have also contributed some money. So there has been some money input as well, but not really a fortune has been put into it. And yet we've basically, I think we're revolutionising a community and improving its health. But just take us back a few years, Wefwafwa, if you don't mind, before we talk about the current projects. What were the first things that we did together?
We started with the basic health education, just moving from one community to another or one village to another, teaching people about the balanced diet, how they can make things like oral rehydration salts, how they can know malaria. And then we went on planting trees in different villages. This has helped to produce fruits already, though 3 years have not yet elapsed. There is a video that I uploaded, and I people were able to see that we had started getting some oranges from the plant that we started with in our first video of community outreach that we put on this YouTube channel. So from there, we went on and started the things like giving mosquito nets to help in preventing of mosquito bites, which are very dangerous because they lead to malaria, which claim a lot of lives here in Uganda, and also it causes a lot of suffering. And then also we reached a time where we were able to buy basic equipments like blood pressure machines and glucometers. We were able to teach the community members, and they are now taking their own blood pressure, and they are able to know how they are standing, and when it is getting out of control, they are able to seek medical attention. We went on getting land. We started planting our own food to help in addressing the malnutrition, which is a very big problem in Uganda and of course other parts of the world, but mostly Africa. And we went on to establish the milling house or milling plant that is helping to mill the food that we give to the community, but also milling for people around the community. Many people are working in all those departments, and of recent I've been giving updates on our poultry farm. So we went on to establish a poultry farm that is supplying eggs, which are helping to tackle the same problem of malnutrition. But in general, we are also tackling the issue of food insecurity. So there is food in our area because we also went on and started buying food. Previously, people, after harvesting food, they used to sell it off, and in terms of need, people could struggle to get food. So we used to buy in time of abundance, so we release it in time of scarcity. So right now, at least we haven't reached, of course, at a point where the community has everything, but there has been a very great change in these few years in our community. Financially, people are having some money because they are able to work in the organization. They have food. We have been able to reduce on the cases of malnutrition, on the cases of diarrhea, due to our health education programs on the hygiene and many things. So there is a very great improvement in a community, and everything is moving well.
And as well as that, we've sponsored individual patients, haven't we? So we've looked at people with diabetes, one young lady with a severe breast disorder, other people with conditions that needed surgery, some people with injuries, and then of course we've got Benny with his osteomyelitis. So we've been able to help quite a few individual patients. And while it's good to help these individual patients, the way you've made the videos also illustrates that they are representatives of a much bigger problem, aren't they? But just to clarify, when we video these individual patients, do we always get permission from the patients before we do the videos?
Yeah, actually from the very beginning, from the first video that we made that I uploaded on YouTube, when we were talking about the lady who was living with the hypertension unknowingly, she gave us permission, and everything that we bring on this YouTube channel, we have a consent form, and then which we have written in local language and in English. So we read everything and interpret. We tell them the purpose of the videos that we make, and they all consent and they are all happy. That's why there is no any setback that we have received, because we make sure that we explain everything, because we don't want people to be exploited. We make sure that we tell them that whatever we are doing is to help them, but also to spread awareness that may help other people. So it is not usually for them only, but it is for the benefit of the whole community, because they are just a representative of the bigger problem that we have in the community. So everyone consents, and they are very okay, not only with us using the video, but also for subscribers there who have good intentions. If they have good intentions, they can as well use the video, because we inform them that several people can use the video. And also, whenever we take the video, it is not a guarantee that whoever we take the video is going to be helped, because we usually put videos out there, but we don't put that maybe it's a must that people will send us money and we help them. So what we usually do, we give them whatever we have, but then we put out a video. If some people come through and help, it is good, but if they don't help, it is also good. So we don't want them to think that we are trading videos for money or to get money to help them. We want these videos not only to be as a basis for helping, but also for people who may be interested in just studying. Someone may be out there, but maybe is interested in a condition, may not donate anything to us, but if it contributes to science and it can help to build knowledge, that is also good, and we inform them about that as well.
And letting people know about individuals in need, whether you believe in prayer or not, you can think about these people, you can have positive thoughts, and if you believe in prayer, you can pray for these people. It's just good to raise awareness in general. Now, a lot of these people that we've treated have done they've got dramatic benefit. Like, we've saved a lot of lives, there's no question about that. If we hadn't intervened in some of these cases, what would have happened? For example, if we hadn't intervened in Ben's case, do you think he'd still be alive?
Of course, we can't tell, but there are very high chances that Ben wouldn't be alive if we have not intervened, because this is seen in the cases where we reached very late. There are cases where we found at a point where we can't reverse what has happened, and those cases have died. But those people that we found in a time where we can do something that can help, they have improved remarkably. Like Ben, the problem was beyond just the sickness, and because of the approach that we use, it benefited a lot. We had to dig deep into his life. We found out that the father neglected him. Actually, up to now, I've never seen him. He lost the mother. So his life was not only about the sickness, but it was the whole life. So we had to treat him. I had to adapt him. And now we have taken him to school. Right now, he's doing very well. Actually, he wrote for me a letter, a very good letter. When I went yesterday to check on him, and I found he has written a very heartfelt letter that I will soon put on a YouTube channel. It is very good, and it is showing me what is in his heart. He knows where he was, and he sees where he is, and now I think in his mind, he's not scared of the future because he knows that he's in the right hands. He's at peace. And then we have other people like Anna. Anna had masses that had the chances of progressing into malignant tumors.
And she was in constant pain, wasn't she? She was in pain all the time.
Yeah, she was in
constant pain.
Yeah, she was in constant pain. She was not at school. She could not associate with the other children of her age because even the masses were very heavy for her to move. So it was very difficult for her. But when we went into her life, people still contributed. On our channel, we were able to have her undergo surgery. It was twice because the masses were not easy. We had to get someone who was very skilled. So it needed a lot of money, but people contributed, and we were able to have her undergo the surgery. We did not only end on that, but we went further and we asked about school, and we had to make sure that she goes back to school. As I talk, she's studying. She's able to associate with all other children of her age, and her life has changed. She's a very happy child. There are very many other children that we have helped, those ones who had malnutrition. They were very weak. They couldn't even stand. They were going to die. But right now, they are very strong. They are growing. We have the story of Christine, a twin, who we found. The twin brother died because we found them late. But we were able to help Christine. She has grown. She's now very strong. We have a story of Esther, who had the Baxi lymphoma, a very dangerous tumor because it progresses very fast. But we were able to help connect her with the Cancer Institute. She started treatment. Right now, she has improved. And very many other people that I don't upload on YouTube because, like I said, those ones who don't consent, we don't put them on YouTube. But we have very many people. Some people, we just help them as groups. We have done several medical camps where we have treated over 1,500 patients per medical camp. We have done several home visits, older people, children. I mean, like a lot of things. I cannot mention everything because a lot has been done. Also, we have built structures on ground. A lot has happened on ground that I cannot mention if we just had a brief time like this on the interview.
I mean, I think what you've done there is really sum up that situation. I mean, we had the twins there, and you discovered them when they were already quite severely malnourished, and we're just it's so wonderful to see twin Christine now doing so well, but yet we lost the brother. If it had just been a few days earlier, it could have been a different story. And when I was there, some of the kids that were playing around, just a few weeks after that, one of them got malaria, and again, you weren't informed in time, and the child died. Quite tragic, and yet with very basic interventions, we can actually save a lot of lives. Most of this, okay, it's things like Anna, we needed a clever surgeon. But a lot of the things you can treat just by giving nutrition, antibiotics, antimalarials in the village, and lives can be saved just with very simple interventions. And parents can be trained to recognise things at a much earlier stage. What do we do about payment for these things? If we hadn't intervened, these people wouldn't be able to afford treatment or understand what treatment was required. Do they have to pay us for the work that we do for them?
No one has paid anything for the work that we have been doing and that we continue to do. All the work has been facilitated by generous people who watch us on this YouTube channel. We haven't received any money from maybe a certain big organization or from government for anything that we have done, that we have put on this YouTube channel. Whatever we have put here has been supported by the people who watch us, and most especially the people who came from your YouTube channel. I know I mentioned that a lot, but they have done a lot of work here, and the amazing part of it is that these people always stick around. When they come on my YouTube channel, they stick around. So even when I am uploading a video on a certain activity, they trust me, and then they keep on supporting. So I'm really grateful and humbled.
So the money's come, obviously, you and me both make some money from YouTube, so money's come from that. But I think probably most of the money has come from individuals that have supported particular projects, which is really quite amazing that people have taken this interest and followed this through. And who's visited from the UK, for example?
From the UK, we have received several visitors. At first, we had the Dr. John, who came with his team. You came from UK, and we were very happy. You came with your lovely wife, and the other people who came in. Val, though she died.
Val was there as well. Yeah,
was here. We are always grateful for the time that she spent here. She touched a lot of lives. The time she came, she was playing with children. She brought for them balls. She created a lot of memories. And when people heard that she died, the whole community felt a great loss. We also had Shan from UK. He's doing a great job. He's the one who is managing our website for the organization, and he has been participating in several crowdfunding or GoFundMe campaigns. So he's the one who handles it, and he has been of great help. I think he also joined the first time you hosted me on your YouTube channel, but since then he has been of great help. He has been there, he has never left, and he is always monitoring closely whatever is happening. Yeah, but we would like to have other people visit us in the village, and they come and see what is happening. Because when Sean came around, we took him around the people that we are helping. He was able to come and see the work that is on ground. We went and did the dressing of Ben while he was staying at the former home. We went and visited Anna and many other people. Yeah, so yeah, we are grateful for people who always come.
How many orphans are we directly feeding at the moment?
At the moment, we are handling about 250 orphans. They are receiving free meals daily at school. So it has helped a lot. By the way, I haven't published all videos, but our team visited them at school, and the head teacher was very happy. Since they started eating the meals, their performance at school has improved so much. They are very happy, and they look very healthy. Yeah, so with the time I'll be putting up all those videos, but it has helped a lot.
Yeah. So as well as helping them not be hungry, it's helping the development of the bodies and the brains, which is making the next generation more intelligent. What crops are we growing on the land at the moment? Let's go through the crops.
Yeah, right now we are growing several crops. We are doing actually mixed farming, and every crop that we are putting on our land is very important for short-term and long-term solution for the food insecurity. So for short-term, we have foods like maize on our land. We have planted in all gardens. We have groundnut. We have beans. We have and other foods that I may not remember, but we also have bananas that are going to offer short-term and long-term solutions. We planted a lot of bananas, and next year we should be in position to start harvesting them, and they will last for over 10 years if taken good care of. We also have coffee that we have planted inside the farm. So inside the farm we have right now maize, bananas, coffee, and then we have, of course, the hens
and the fruit trees as well.
Yes, we have a lot of fruit trees. Some we gave to the community members, every person to have a fruit tree at home. Then we have a garden that is set up for only fruit, and then we have some around the organization. So everything is growing very well. I think this is going to solve the problem of food insecurity that we have been struggling with in the past. Now getting food will not be very difficult.
Excellent. But of course we can expand to bigger and bigger areas and incorporate more and more people. I mean, for example, we still have trouble with anemia because of poor nutrition, don't we?
Yeah, we have many problems, but the system that we have used, it is trying to cut across. We are trying to tackle these big problems. We are not yet there, but at least we have moved. We have moved a certain distance, but we still have a lot of problems. We have problems, of course, with even emergency care. We have problems with anemia still. So there are still a lot of people dying, most especially those ones that we cannot be able to reach, because there are very many people suffering, but we are able to reach some people with the resources that we have, putting it in mind that as we help people for short term, we have also to build for tomorrow. So as we are building, we are helping them. So that is why this sometimes becomes difficult, because we have to invest at the same time as we give out some resources to some people. So it is something that is very complicated, but very good. I mean, it is easy. The things that we do are easy. They don't become hard for me. The whole thing is, as long as resources are there. I mean, when we have funds, we are able to put together all these things that we are doing. We know the solutions, but what limits us is the money. For example, we know that if we have more land, we can we can plant more crops and we shall not have a problem with food. But we cannot have all the land, even when it is available, because sometimes we are limited with the money. So sometimes we buy land, and then sometimes we just do the planting. So we are building it like that. As while we build, we work. While we build, we work. So it is something like that.
But we're aiming towards being able to produce enough income to support the project. So this is an ongoing project, so that, you know, when my YouTube channel's no more and I'm dead, this project will still be going on because we can still generate income.
Exactly. That is the approach from the very beginning. We want things that are going to outlive us. Just because the thing is, we have a very short life in this world. We just don't know when we are going. So we want to make sure that we make the best use of the time that we have while we are here, while preparing the next generation, and the structures that we are trying to put. We want to make sure that they outlive all of us, even maybe some of the viewers who are watching us. We want at a certain time when we are all gone, this should be able to stand, and we want to make sure that we make it self-reliable in a shortest time possible. So that's why we are doing a lot of investment most of the time.
How are we improving animal welfare, and how are we using the improved animal welfare to promote good ecological environments?
Right now, with the animal welfare, like people who have seen our hens, like of recent, I made a video when I was trying to call the hens to come for food. They are in a very big area, like nowhere else, because like the farms that I've seen in towns and in other areas, people have like 1,000 hens put in a very small area, and we are not just okay with that, and we can't allow it. So we fenced a very big area. We made sure that food is there, we have enough shade, we have water there, so hens are moving freely. And surprisingly, when we opened them and they were free and happy, the production increased. They started laying more eggs. So this has helped us. And when people around saw that when you have hens in a free range system with food there, when they have enough space, it improves their productivity, and many people are learning from there. This is something that has happened first, like in the whole district. I've never seen something like that in my district, but it's something new that we thought about, but it is turning out to work very well. And even the government officials from the district, they have started to direct people to our organization to come and learn something that they will replicate and put in another area. So we are actually becoming model farmers, though we were not farmers initially. This is something that we never use the sophisticated information, but experts are coming to learn from us. They are asking where we learned these things. It is changing the culture generally, and it is setting a very good example in the country. When I put up videos, several farmers across Uganda inbox me and they ask me the costs of how to start something like that, and I give them advice. Though I'm a medical personnel, but now I'm becoming an expert in farming as well. So it is something that is very good.
I think what we've done, you and me have had long conversations. We talk all the time. And I think what we've done is we've just applied basic scientific principles. So we apply some basic scientific principles. For example, something as simple as the intercropping between the coffee and the bananas. The way that they can synergize each other. And then the chickens are running around pooing and fertilizing it. So over time, we're going to get a better production of coffee and bananas and happy chickens and more eggs. You know, all these things work together. But while we are applying sound scientific principles, we are operationalizing those scientific principles through local expertise. For example, the manure man knows how to make the manure, and then we're digging the holes, putting the manure in, planting the bananas. So we are applying the basic science that you and me understand from our scientific training, but using that through local expertise. So we are not overriding local experts. We are learning from local experts, and we are synthesizing scientific principles with local expertise, and that's why it's working so well.
It is working very well, and what I realized, we have very many people who are experts in different things. I mean, local people who have not even gone to school, but they know a lot of things. Sometimes they just need a little guidance. Like when I say that we want to have the coffee, want to have the bananas together. So the one of bananas, when he came, he demonstrated a lot of knowledge and experience in doing things. He taught me how he does the manure, how he gets the grain, and then he mixes with the cow dung, how he puts it, how he prepares it, the time and everything, and then how he measures the holes for the bananas. And then when I reached out to the local guy who does coffee planting, he's also doing a great job. So when they are together, we have also another person who is into the poultry farm. They have a lot of knowledge, and all these people together, they are doing a lot of work, and they can't believe the results when they see all these people working together and things are happening.
Yep, absolutely. One of the most amazing ones to me was the engineer who made the milling equipment. I mean, we told him what we wanted, but then he had the expertise to put these electric motors into this whole milling thing, and we get like this really good quality flour out. What do local people think of our flour and our products? Do they think it's rubbish, or do they think it's good quality flour?
Actually, if you just came to our village, maybe when the machine is not running for a day, you will find complaints not only to people surrounding, but even to people who come from very far places. We have not only local people, but even people come from far places, because our flour is of high quality. And there is also something that we have put in our workers. We want to make sure that the people that we are employing are of high integrity, and we think about the hygiene. We think about what people are going to eat. For example, if maybe they sold to us maize that we found out that it was getting spoiled, we pour it. That is the thing. Whether it is going to make a loss, once we know that it's not fit for human consumption, we can't give people to eat. So people buy our things with the confidence, because we make sure that whatever they are going to eat is safe. And even people who bring their food to process, we check it and we advise them. If someone brings food that we know that it's not safe for eating, we can't allow to allow that person to go ahead and eat that food. We always want to find a solution with them, and we show them the dangers. So people like that place. Everyone will say, for me, I go to Buwanga, and they embrace it too much because it means light. So people trust everything that comes from Buwanga, and we want to make sure that that is maintained forever.
Less scrupulous operators might mix some bad flour with some good flour and try and get away with selling the bad flour to make more money, but we don't. We focus on making sure it's a good quality product.
We make sure that that doesn't happen, because it is very dangerous. The whole thing is life. We are not there to make profits, and even if you made it profit, we, like I said, after a very short time, 100 years or 50 years, we don't know even the time we shall all not be here. So it is not important to keep anything. It will not do anything. We are just here to serve each other and make sure that everyone is okay, and that doesn't affect us. Because if people are okay, how do we lose then? Yeah, so we just want to make sure that everyone is happy and we are living.
What are we doing about local training and improving the skills of local people?
We are doing a lot with the skilling. We started the skilling center, and you sent us money, by the way, where we were able to purchase the sewing machines. There is, how do we call them? Is it sewing machines?
Yeah, sewing machines. Yeah, the treadle sewing. They're called treadles. You just work them with your feet. So very low-tech sewing machines.
Exactly. Then there is also another subscriber of ours. She preferred not to mention her name on the video, but she bought us also 2 sewing machines. I don't remember the actual number, but we have now enough for all the ladies and the young men and women. They have all learned a lot of things. They have started making for us clothes, even the overalls or the clothes that we are going to start using in our videos for the farm. They are all made by the people that they just started the training a few months ago. They are soon going to graduate. I think we will make a video and you will be able to see the skills that they have all acquired. This is not only going to help them even to make clothes for themselves, but some of them will be even retained on the organization to help in teaching others, because we just had one teacher who was teaching them, but now we have some outstanding students who are going to remain and they will be teachers, and we shall be increasing the number like that. But some people who may choose to go out and make clothes and sell, they will also do that. And with the time, we are going also to be making some clothes on the organization for selling to the local people, and hopefully in the future we will be able to export some of our products that are made by these local people, and I believe that will help to improve their life.
Yeah. And hopefully we'll be exporting some coffee as well. We can make some money from the coffee that can go back into the organization.
Yeah, we have planted a lot of coffee that I know we can't consume locally, all of us, because at least here some people have coffee, they can access it if they needed it, and they have more pressing issues that are bigger than just taking coffee. So if we have some kind of people out there who can take our coffee, it will be a very great thing. By the way, we welcome that. Some of the coffee that I first planted on some of the gardens out there is ready this year. If some people are willing to take some of our coffee, I will really be grateful. We hope to have some coffee in the coming few months.
I'm looking forward to trying my first cup, so that's we can feedback when I try it. I'm sure it'll be quite excellent. What is the main project you're working on at the moment? What's the new thing that we're developing?
Yeah, the new thing that we are developing in our work, like you saw, we have been visiting people in their homes, and it has been of great benefit. That has created a very big impact, and that is something that we are still going to continue doing, because it is the foundation and it empowers a lot of people. But on top of that, like you saw last time, I was able to stitch a young man, and I used the very few resources, and even the area where I was operating from, it was very difficult to maintain a sterile environment because of the limited equipment that I was having. And there are some patients also in the videos that we helped who had reached a certain stage, mostly those ones who were very sick, and we were managing them from home. We realized that sometimes these parents, some of them, of course, even when we teach them about these diseases, they are not medical personnel, so they cannot be able to identify some features when these patients, most especially children, are complicating. So sometimes you may have a child that you have helped in the community who is in a very bad situation. Maybe you even refer them to the hospital to go and get care. But because they are poor, they may accept, but they will not take that child. So we give we give them that medication to start them off, but then you realize that they don't continue with what you tell them, or they are not able to identify those complications. So what we wanted to do was to have a place where we can at least handle emergency cases, for example, like that child and others who may get maybe an accident, maybe if someone also who has a chronic condition like hypertension, it goes up. We can stabilize them. Maybe someone has hypertension, we can stabilize. Then we want to have a place where we can handle emergencies, and then also a place where we can keep those special cases that we find in the community. So we want to equip it with the basic equipment, like maybe an oxygen cylinder, and then a blood monitoring, vital monitoring machine, and then some few things like a glucometer, blood pressure machine, that can help to monitor some patients that we know that we can't live at home, and we know that they are not able to go and get further help. And then there are also conditions. We have lost a lot of children, like in the community, like that child that died when you just left. It was just malaria. We needed just a few medications to save that child. If we had a place, even when I'm not around, where they could go and get that basic treatment, they would have not died. There is also an example of my grandmother, who I was also not around. Alice, I think most people remember how we bought her a wheelchair. She was among the people we were monitoring on this channel, but I had moved, and she got malaria that was not treated well. By the time I returned, she was already complicating. She was going into multiple organ failure. So even when I was able to get her, and we took her to the largest hospital, the regional referral hospital in our area, they were not able to save life because she missed the basic treatment that would have saved her. So she ended up dying because she left a very big gap in my heart that will never be replaced. And I just imagine what happens in the hearts of very many people who lose children very young, the pain that they have, and the productivity that we lose in our community, because now we lose these children who could have done something that could have helped in the future. I just imagine if we had maybe people like me, or people who are better than me in my community or in communities around Uganda and around the world, it would be very good. So I really wish to see that we don't lose like people prematurely, and we just don't lose people easily like that. I just feel that if we have something that can offer emergency care, it would be very important. So right now we are putting up two extra wards. One will be for boys and one for girls, and then a consultation room. And then we have the house that we built that was helping us to act as the office, and it has many rooms. So we want to equip those rooms to help in dealing with these cases.
Mm-hmm. So a lot of the time you're preventing complications from occurring. So for example, if you treat malaria early, you can prevent the patient going into a coma, because the malaria in that area can sometimes cause cerebral malaria. So we can prevent these complications, but sometimes people have already complicated. So for example, that wound you're able to sew up, you stopped it becoming infected. But other wounds we get when they're already infected and the patients are at risk of getting something like sepsis. So we need a facility for treating patients that are more ill, because treatment often has been delayed and the patient's already deteriorated. So I agree completely. We need both. We need to prevent as much as we can. But then when a complication has already occurred, we need a facility, which is often fairly basic facility, to be able to treat that complication. Is the government taking an interest in this project? Can we expect any support for this new centre?
Yeah, the government has paid like a close eye on our activities since we started. I think the organization has showed something that is very different from other organizations that have been working in Uganda. The health authorities at the district are all interested in the direction that we are taking, and of recent they were interested in bringing us services of blood transfusion. There is a strategy where they want people to donate blood and use, because they realize that sometimes when they move in different areas, some people were not willing to donate blood because of course, some cultural beliefs. They believe that maybe if their blood is taken away, it's not safe for them. So they want people to collect blood within the area. They take it to the regional facility where they screen for all infections. They do all the biochemistry, whatever is needed to be done on work, on blood. They do it, and then they give us even the storage facility for that blood, and they bring it and keep it there, such that when we have like a child who has already severe anemia due to malaria, which is very common, we can be able to connect blood and even avoid congestion in the regional referral hospital, where many people go and they end up even not get blood because very many people go there and sometimes it is not enough. So they want us to be able to treat these people locally, and they were looking at our organization as one of those organizations that can benefit from that service because of the work that we have been doing. They believe that we can do that and help people.
That's another thing that we do, isn't it? We're combating local superstition for people that probably aren't very highly educated, and replacing that with proper science and proper medicine and proper belief structures, taking away from the idea of illness caused by curses, and that can cause a lot of civil strife, because if one neighbour believes that they're sick because the next door neighbour put a curse on them, they're likely to go round and have a bit of a fight with the next door neighbour. So that's another thing we're doing, isn't it? Taking away superstition and replacing that with science and proper medicine.
We are not only looking on the science side, like saying, oh, we don't believe in anything. We are offering spiritual support as well. Like of recent, you bought us over 200 Bibles, and it is helping. We have given people are reading the Bible, but we are not only supporting that. We are always teaching them science. So once they come for a prayer meeting, we also talk about science and how things happen. So I sometimes some people who watch my videos are not comfortable when we talk about faith and all these things, but the truth is we are in science and we are in faith, and these things, when they work together, it's a beautiful thing, because you will not go to someone who believes and you replace that at once with science. It's a very difficult thing. It's always important to listen to what they say, and then after you listen, and then you present what you have and you work together. And all these things don't affect us at all. The knowledge of the Bible doesn't cause anyone to die, and the knowledge of science doesn't cause anyone to die. So it is helping to build a community that is working together, that is loving each other, but we are operating on basic principles that anyone would like to operate on. For example, even if you don't believe in God, but if you don't believe in God, but you believe in giving, when like people who have helped us, we have very many people who don't believe in God, but they have contributed towards our activities. And it has helped. Even those ones who believe, they have contributed. It is all helping to better this community at the end of the day. So I think people understand that this will not harm us at all at a particular time. It is just helping to improve this community overall. So it is not something that we should worry about.
But that's also what we believe in. We believe in synergizing belief and science, and we combine these in the best possible practical way to get the best possible outcome. Wefwafwa, excellent. Thank you very much. If anyone's interested, we'll put all your links at the bottom in the description, and do come back and update us anytime you would like. I'm sure there's lots we haven't talked about. But this is a model project for other parts of Africa to emulate, and I think this has got potential. Well, it's already helped people locally, starting to help people regionally and nationally, and hopefully throughout Africa as well. And of course, we could have talked about other plans that we have for medical research and environmental research and all the other things. We're developing herbal medicine. We haven't talked about the cows. We've now got 4 cows for milk and animal products for milk to use with the eggs. So many things, and more research to be done and more learning to be done. And the most important research to me is synergizing the belief and the science with the local expertise. And that's what this project is about. It's about respect for local expertise, about respect for traditions, but yet synergizing that with Christian belief and with science.
Exactly.
Yep. For now, thank you, and we will talk again soon.